loving God. We stand in gratitude as we remember all the people whose paths we have crossed, who have left footprints on our hearts, tears in our eyes, and smiles on our faces. We stand in gratitude for our ministry as caregivers and sojourners at the end of life's journey. Bless the work of our hands, bless the work of our hearts. We stand in gratitude for our mission as hope-filled believers in the comfort, respect, dignity, and love of all those whom we are blessed to serve and will serve in the future. We stand in gratitude for the vision bestowed on Mercy Medical Center and the community of believers 30 years ago, which brought and will continue to bring respect and dignity at the end of life. May the ministry of Hospice of Mercy be blessed for 30 years to come and the 30 years beyond. Amen.
Thank you, Kim. Now it's my pleasure to introduce Tim Charles. He's the president and CEO of Mercy Medical Center. I think that's enough said. Tim?
Thank you, Leanne, and good afternoon. We really appreciate all of you coming out to join us for this wonderful occasion. Hospice of Mercy, which today brings comfort and support to hundreds of patients and their families every year, faced controversy and criticism 30 years ago when a small group of volunteers attempted to create the first hospice in eastern Iowa. Don Baumkamp, now retired family physician who introduced the hospice concept to the Cedar Rapids medical community, has told the story of the challenges the early hospice faced. At that time, the philosophy of care was not to allow patients to die at home, but to care for them in the intensive care unit. Dr. Baumkamp's desire to see hospice services in this area were precipitated by the terminal illness of his son David, who was diagnosed with malignant melanoma in 1978 and died in 1980. When he and a few nurses, social workers, and chaplains who volunteered to work with him shared the message of hospice, they were met with misunderstanding from physicians, pharmacists, funeral home directors, and many others. His ideas were well ahead of Iowa City, the Mayo Clinic, and other significant healthcare organizations, and soon others started paying attention. The biggest asset Dr. Baumkamp had was Mercy Medical Center. As the first hospices in England were started by nuns, Mercy administration run by nuns were way ahead of the game, and he had no trouble convincing them to support this unique new type of healthcare. Dr. Baumkamp was joined by Sister Susan O'Connor, then a social worker, Scott Lindsley, then also a social worker, now Operations Director of Post-Acute Services at Mercy, Dorothy Stewart, Head of Psychological Services, and a nurse, Jan Adkins, the first nurse manager of Hospice of Mercy. Many family pastors in the community also supported the hospice philosophy. There was no reimbursement of any kind for hospice care. Mercy took full responsibility for the program. At the time, a busy time may have included 6 or 7 hospice patients, and all who helped were volunteering their time. Gradually, changes in the medical community and cultural attitudes brought new understanding and support for the hospice concept of care. As oncology care advanced, Marty Wiesenfeld, who came to Cedar Rapids in 1979, became an invaluable supporter of the hospice concept. After 4 challenging years, Dr. Baumkamp left the program in the hands of 4 physicians, one being Dr. Ken Searlock, who is here with us, who became the program's leading physician advocate and remains medical director today. In 1980, there were 3 patients served. In 1986, it had grown to 88 patients, and in 2010, over 700 patients and their families have been cared for by hospice. So what's changed in that time? Well, there's now a Medicare benefit that was established in the 1980s. There's research in the end-of-life care. It's an evidence-based specialty now. Physicians, nurses are board certified in providing end-of-life care. Comprehensive patient and family-centered model of care that provides services that include not just nursing, social work, but also chaplains and volunteers, but many other services that have been proven to help families and patients with the comfort and support. There's also music therapy and massage therapy. There's extensive volunteer training. There are over 150 active volunteers now engaged with this program. And there's an extremely competent and compassionate team of 90. Accredited by the Centers for Medicare and Medicaid and the Joint Commission, training opportunities for medical students and nursing students, social work students in advanced degrees. Thanks to the providers like Dr. Ken Searlock, Dr. Cindy Squires, Dr. Sharon Ghosh, and soon Dr. Fadi Yaqub, our team now delivers over 36,656 visits a year. Our volunteers contribute over 10,000 hours of their time. Our benefactors, the gifts that we receive each year from each family, enable us to continue the mission